Molly, over to you.
Okay, Chris. Well, I am here with Dr. Christin Martino with Catawba Radiology. I'm so happy you came today.
Thank you
We're
for
going to
having
use
me.
this as an excuse, International Women's Day, to talk about mammographies.
Okay.
They are important. Why?
They are important because they are diagnosing cancer at an early stage, a stage that is treatable, to give women more treatment options, more curable rates, and to have better cosmetic results, less extensive surgeries, and often less expensive in the long run.
So how old do you need to be when you get your first one?
We as a specialty are recommending beginning at age 40 because we're seeing 1 in 5 to 1 in 6 women with breast cancer are aged 40 to 49, and that's a big population of people we don't want to miss by starting later. Although there is a population of patients who have strong family histories that need to be screened earlier with first-degree relatives with breast cancer, as well as those that know they have a genetic risk of developing breast cancer.
I have a lot of questions from people. I mean, I have friends that have been in their 20s who have been diagnosed with breast cancer, and it runs in my family, so I hear a lot of stories.
Yes.
But people are always saying insurance won't cover it, or how do I find a free one, or what if I want to take care of my body but I'm only 30 and then therefore it's going to be too much. How do you answer those questions for people that really want to get checked?
I think it's reaching out first to their clinicians to seeing what resources are available, and certainly stopping by and exploring what options we have with radiology groups to see what in the community are extending out to those patients who are at high risk, who can't pay with insurance, who need to be screened because of those reasons.
Okay, now you brought, Dr. Martino, a picture, I think, of a clean scan. This right here is a mammography machine, but if we have a picture of that clean scan, I want you to talk us through. So this is a clean scan from a mammography of a clean breast. So tell us, like, we don't see anything there.
So we don't see anything, and it probably looks confusing. What are we looking for on a day-to-day basis? But this is one image. So a normal mammogram, as women out there who've had them have 4 pictures taken of their breasts. This is one picture for reference. But what I'm looking for is the whiteness and the blackness. The whiteness is the glandular tissue. Am I seeing anything that looks like a lump or something like a size of a grape, a peanut, something that stands out besides this streaky whiteness in the picture? And every day, that's what we're looking at as radiologists and mammographers, trying to look through all that tissue, all the subtleties of finding early cancer to make it treatable.
And see, to me, who does not a trained eye, I wouldn't see if that looks normal or abnormal, but you're looking for specific things in that scan that would pop out.
Yes, specific things like lumps that I mentioned, and calcifications, which can't be felt. Calcifications are in some cases a sign of the earliest form of cancer that we can find on a mammography and treat and get that patient the care they need.
A lot of people say they get scared of having mammography because it's this big machine. First of all, you're having to be half naked, undressed, put your body into this machine. It's very impersonal.
Impersonal, pushed and pressed on.
Right, and it's not necessarily painful, but it's not comfortable.
Exactly.
But it's not horribly painful. But I had someone tell me something I'm going to pass on to you, and you can tell us if this is nuts or if this is a good idea.
Okay.
Because maybe it'll help someone else. That to name the mammography machine. So I named the last one I had last year Maggie. It was Maggie the mammography machine. So then if you're hanging out with Maggie, it's a little bit more personal and a little bit easier to sort of sit there than feeling like this cold, impersonal disconnection from something, because it's so important to get done.
Correct.
People are saying whatever you need to do to make sure you get it done, you should do.
I've not heard of that before. It sounds like it might be something good to get through the exam. But, you know, just in the long run, you think that 20 minutes of that time could save your life. Whatever, you know, is uncomfortable about it, do what makes it feel comfortable for you to do something that could save your life.
I was going to say, any other tips for anyone who's scared to get one?
Don't be too afraid. Don't read too much online. What you read, it's not as bad once you get in there.
It's not as bad.
Yes.
Dr. Martino, thank you so much for Catawba Radiology. It's been great. And Coach, take it away.
And that was great information. Thank you.